Governor Cuomo says he's worried about COVID-19 overwhelming our hospitals. The governor's saying the state will work to prevent that by factoring in hospitalization rates and hospital beds as it designates microcluster zones. Now, the state will ask hospital systems like URMC and RRH to balance patient distribution across their footprints so no one center is overwhelmed. The governor calling on them to add 50% bed capacity to meet a possible surge in hospitalizations. New York is also once again turning to retired nurses and doctors to help address staffing shortages.
We are now worried about overwhelming the hospital system. And if those numbers continue to increase, which we expect they will, you will see serious stress on the hospital system.
The state says small gatherings are responsible for 2/3 of New York's COVID cases. It's led to a positivity rate of 4.57%. Hospitalizations across the state are at just over 3,000. That's an increase of 160. There are 54 COVID deaths reported statewide since Sunday. Governor Cuomo also saying earlier today that new schools entering an orange zone will not need to close for 4 days before reopening. Going forward, schools in orange zones won't require all in-person learners and staff to get a negative test. Instead, schools in orange zones will have to test 20% of students and staff monthly. Now, the governor says he wants to keep grade schools open as long as possible.
We believe in keeping especially K through 8 open. The schools are safer than the surrounding community, and children get an education, and parents can work, etc.
The Monroe County Sheriff's Office is getting just over $150,000 in grant money to help prevent terrorism and other violent acts. That money is going to the Rochester Threat Advisory Committee, a task force formed last year to prevent violent acts from happening. ROCTAC serves as the center point of communication between several agencies for dangerous threats of violence on the community. Officials say the funds will allow ROCTAC to expand its services.
We've all seen the horrific cases, and when you look at those cases and piece them together afterwards, after the tragedy, you can see the puzzle pieces that failed to line up because the systems didn't line up.
Now, the grant money will also help support other upstate cities develop their own threat assessment teams.
A Batavia funeral home director is facing a slew of new charges after police say he held a dead body at his funeral home for 9 months. Genesee County Sheriff's deputies say Michael Tomaszewski of Tomaszewski Funeral and Cremation Chapel held the body from April 2018 to January of 2019 without burying or cremating it. Police also say Tomaszewski filed a false death certificate indicating the body had been buried in a cemetery. The body has since been properly buried. The funeral home director was already charged with multiple felonies earlier this year, including fraud and grand larceny, after at least 11 people came forward with claims against him, including allegations that he swindled customers close to $500,000 meant to pay for funeral expenses. Tomaszewski is due back in court early next month.
A local nonprofit says it's filing a formal complaint with the state attorney general calling for an investigation into alleged violence on Lyle Avenue. The Little Italy Association of Rochester says the Lyle Avenue corridor experiences drug deals, prostitution, and other crime that affects businesses and people who live there. The nonprofit says it decided to submit the complaint after talking with area residents and businesses over the past year. It's calling for an investigation to figure out why the alleged crime is happening. In a statement, the organization says, quote, "This is totally unacceptable, and we'd like to know who's in on it and why this is happening. This is very simple. It's not about ethnicity or displacing anyone. It's about accountability."
A coronavirus treatment is one step closer to reaching people. The FDA granting emergency authorization to Regeneron's antibody treatment. Spectrum News reporter Adria Irahita learned what it will mean for COVID patients.
The Macy's Thanksgiving Parade still on, even though its 2020 edition will look plenty different. Spectrum News' Frank Dolella lets you know what to expect.
A negative COVID-19 test result may not mean you're in the clear. We learn why from Britt Conway. A former Webster Schroeder coach is suing the Webster School District, Webster Police Department, and others for $2 million, accusing them of civil rights violations. Watkins was found not guilty last year of raping a 14-year-old student in a locker room back in 2017. The lawsuit alleges that Watkins was subject to false arrest, negligent training, wrongful termination, and other charges relating to the alleged incident. The town of Webster is also included in the suit. The lawsuit says Watkins is suing for monetary damages. In a statement responding to the lawsuit, the Webster Police Department says, quote, "We are aware of the filing. We are not able to offer a statement regarding pending litigation." Monroe County health officials are reporting possible COVID-19 exposures at 2 different businesses earlier this month. The first exposure was at the Moose Lodge in Riga. Officials tell us a patron tested positive for COVID-19. If you were at the lodge during the dates shown on your screen, you should self-quarantine and get tested immediately. In Monroe County, reporting another possible COVID-19 exposure at Merchant's Grill. Officials tell us a symptomatic patron who later tested positive visited the restaurant multiple times. People at the restaurant in the time period shown on your TV should also self-quarantine and get tested immediately. Health officials are urging people to call the phone number shown on your TV screen if you think you were exposed. Rochester Regional Health SAS is opening a new unit at Hill Haven Nursing Home that will accept COVID-19 patients if other long-term care facilities can't cohort COVID patients. Cohorting is when COVID-19 patients are placed in a dedicated unit away from other patients to prevent the spread of the virus. All residents and staff members in the new COVID-19 unit will be separated from the rest of the facility. COVID patients brought to Hill Haven from other facilities will be transferred back to their home facility after they recover.
The majority of nursing home residents and assisted living residents who contract COVID-19 will not require hospital care, but they all need to be cared for. This unit can help provide that care should a facility exceed its ability to safely cohort their residents.